Welcome back. Thanks for staying with us here for KREM 2 News at 6. I'm Whitney Ward.
Welcome back, everyone. I'm Mark Hanrahan. Today, Washington State employees need to show proof of vaccination from the coronavirus or potentially lose their jobs.
So this verification mandate is obviously stirring up a lot of controversy, but states have actually been mandating vaccines long before this COVID pandemic even started. The Pew Research Center recently released a report to break down how vaccine mandates are really nothing new here in the United States.
Right now, the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommends routine vaccination against 16 diseases from birth through age 18.
So of the 16 immunizations the CDC recommends for kids, 7 vaccines are mandated across all 50 states.
Those include vaccines for diphtheria, tetanus, pertussis or whooping cough, polio, measles, rubella, and the chickenpox. Every state except Iowa also mandates immunization against mumps.
Now, vaccination mandates in the U.S. actually date back to the 19th century when many cities and states had started requiring children to be immunized against smallpox. The Supreme Court then upheld vaccine mandates in a landmark 1905 decision. Speaking of, new COVID cases starting to go down in hospitals all across the state of Washington, but not nearly as quickly as doctors would like. The State Hospital Association held a briefing today explaining how certain aspects of this fifth wave are improving, but others are not. Hospitalizations have decreased slightly over the last week, but the number of patients on ventilators remains the same. And 10 to 15 people are still dying every single day from COVID-19 across the state. And it is having a profound impact on our local hospitals, especially now that that vaccine deadline has arrived.
Here in Moses Lake, we are also very happy that we kind of got out of September, which was a very dark month for us. However, even in our smaller hospital here, our census is higher than it's ever been. We still are over capacity on a daily basis.
Now, we learned that almost the entire materials management department at Samaritan Healthcare in Moses Lake resigned because of the vaccine mandate. I just visited the Samaritan ICU a few weeks ago to see firsthand how all of this is taking a toll on healthcare workers. Today, we're told it will likely mean cuts in some services, especially at the more rural hospitals across eastern Washington.
We've had to reduce our services in our OR. And some of that is hospital bed availability. Some of that is staffing. We have to use those valuable nurses and other places in the hospital to take care of acutely ill people. There comes a point where we just have to cap what we can do here at the hospital if we don't have the staffing to accommodate that.
Now, to be clear, staff shortages have already been taking place well before today's vaccine deadline, but losing any additional hospital staff could also create challenges in the supply chain, meaning healthcare workers may have trouble getting the basic materials and PPE they need to do their job every day. And that, too, could mean cuts in services for patients.
Tonight, Kootenai Health in Coeur d'Alene is caring for a record number of COVID patients in its critical care unit. 49 COVID patients have filled their ICU. They've never cared for this many critical patients at once. The previous record was 43 in their COVID ICU. The hospital overall caring for 123 COVID patients today, including 1 pediatric COVID patient. Now, we know this is a lot of information, so to make things a little easier, just text us the word COVID to 509-448-2000 and we'll send links with information directly to your phone.